sometimes. The question I was asking you about the clavicle brace was more about, you see people buying these things off the internet to correct their posture and fix everything. What do you think of those?
Yeah, so I think sometimes it is a reminder for patients, and I think if it works for the patient, I by all means I'll say use it. You know, if people are just got into that bad habit of sitting, sort of with their shoulders slouched. I mean, it's quite funny. As soon as you use the word ergonomics, I just felt like I needed to sit. I felt like, because I know I'm guilty of it, as are most people. But sometimes it's just a reminder for them, you know. And quite often I will get people in my clinic who'll come up and as soon as they take the shirt off, they got that brace on, and say, I quite often will say, do you think that helps? And they'll say, yes, it does. It just gives me a reminder as to whether it helps. And I'm sure Rish will agree that if it helps correct their biomechanics, then, and it's a reminder for them, then by all means. I don't necessarily encourage them to go and buy one unless I think they've got a structural problem biomechanically, which could be corrected, where I'm quite often guided by people like Rush, who tend to do a sort of more thorough evaluation of their scapula and then the biomechanics.
That's the answer I was after. Thank you. I must admit, I've got even though I work for an orthotics company, I've got a bit of a dislike of the things because I've seen people use them as an excuse. But that's patient clinical life.